Welcome everybody to this symposium on the state of older persons in the decade of healthy ageing. My name's Julie Biles and I'll be chairing this symposium. I'm the Global Innovation Chair in Responsive Transitions in Health and Ageing at the University of Newcastle in Australia. I'm also a fellow and life member of the Australian Association of Gerontology, head of the International Longevity Centre Australia, co-president of the ILC Global Alliance and chair of the International Association of Gerontology Asia-Oceania Social Research and Planning Subcommittee. In this presentation, we'll hear about life and challenges in the decade of healthy ageing from the perspectives of people from India, Australia, and Singapore. All of these countries have been making systemic efforts to meet the needs of their ageing populations, with these efforts disrupted by COVID, which was a particular threat for older people and which inundated already strained health and social systems. But crises aside, there's never been a more important and critical time to redesign and reinforce how we best promote healthy ageing and support older people in need. Our first speaker is Dr. Mala Kapoor Shankaras, who will present on the state of older persons in India. Dr. Mala Kapoor Shankaras is an international consultant, an academician recently retired from University of Delhi, a researcher, a writer, and an activist with specialisation in sociology, health, social sciences, and gerontology. Her presentation will consider the rapid demographic transitions taking place and how this has compelled the government and other stakeholders to embrace a healthy ageing agenda. Thank you, Mala.
I'm going to be speaking today of state of older persons in India, life and challenges in the decade of healthy aging. I want to start with saying something about the state of older persons in India. I want to share with you that India is aging at a rapid pace, along with the process of feminization of aging. A recent report by the Ministry of Statistics and Program Implementation titled Elderly in India 2021 indicates nearly 138 million older persons in India in 2021, which includes 67 million men and 71 million women. An increase of nearly 34 million older persons was seen in 2021 over the population census of 2011. This number is expected to increase by 56 million by 2031. So on an aggregate, aging population in India has increased by 32.7% between 2011 to 2021, and the general population by only 12.4% during the same period. And also, we need to focus a little on gender issues, which are very relevant for India. By 2031, the number of older women will be twice as many as in 2011. The sex ratio for the aging population is much higher than the general population, which was at 1,065 women per 1,000 men in 2021. While the population of older men is projected to have risen by 26.5% from the 2011 census, the number of older women rose to 39.1%. By 2031, while the aging male population is projected to rise by 39%, from 2021, the number of older females is expected to rise by 41.9%. So after talking about this feminization process, I'm going to say something about the decade of healthy aging. The fast demographic transition taking place with a feminization complexion compels the government and other stakeholders not only to have healthy aging agenda, inclusive for older men and women, but also to raise awareness towards multiple issues on aging from a holistic, rights-based perspective, which enables and expands the contribution of older people in the development process of the society. The decade of healthy aging, taking forward the implementation of the Madrid International Plan of Action on Aging and the Sustainable Development Goals, is the appropriate opportunity to take forward the focus on the well-being of older people. Some of the critical concerns which come are, we know that the reasons for rapid rise in the aging population seen in the last 20 years or so may be associated with longevity of life achieved because of economic well-being, better healthcare and medical facilities, especially in this century, and also because of reduction in fertility rates. Yet, emphasis on geriatric healthcare and related provisions for social care are only gradually developing, and there is still need to have an integrated approach with emphasis on family care, community care, hospital care, long-term care, rehab, and palliative care for older people. Healthcare programs need to be gender sensitive from a rights-based perspective, incorporating a life course approach. In addition, emphasis has to be on preventive and curative services by focusing on active aging throughout the lifespan. It is important for us to understand the risk factors and vulnerabilities of older men and women in terms of care and support, and this should be given priority. I now want to focus on some of the initiatives which have been taken by the government in the recent times. The Government of India has started the National Program for the Healthcare for the Elderly, which is called NPHCE. It aims to deliver comprehensive, affordable, and quality geriatric care services at primary and secondary levels. It brings emphasis on outpatient services, health and wellness centers, geriatric wards at district hospitals, and provision for rehab services. There is focus on developing mechanisms for providing home-based care by imparting caregiving skills to family members, besides having facilities for specialized care provisions, having strong cross-referrals, developing a strong workforce of geriatricians and geriatric care providers, both medical and paramedical professionals. There is emphasis on need-based continuum of care approach, and it thus aims at mainstreaming aging issues related to older people. Another very remarkable initiative in recent times is the LASI, initiative, which means that India has initiated its first longitudinal study on aging, referred to as LASI, as part of the wider network of health and retirement studies with access to standardized survey tools and protocols, thus allowing for internationally comparable data as per recommendation of the Madrid International Plan of Action on Aging. This survey captures physical, health, and economic conditions of older people, along with various social security measures available for them, their level of awareness and use among the 60+ population through key indicators of active aging index. Now, we cannot talk of the decade of healthy aging without talking of the COVID pandemic impact, because this was right in the midst of starting of the decade of healthy aging. Talking for India, there was a low level of pandemic preparedness as the vulnerabilities of the health systems became strikingly visible, especially because of the high burden of non-communicable diseases prevalent. But India did well in mounting an appropriate response to the pandemic, including for older people, especially with vaccinations. The rate and proportion of deaths attributed to COVID-19 have been lower compared to other parts of the world. However, the country reflected high rates of mortality and morbidity among older people compared to the young as a result of the COVID-19 pandemic. The Global Health Security Index indicates that in India, while the whole population was affected, the older people were disproportionately more vulnerable to the pandemic. Thus, there are a number of challenges which we come across. The pandemic has indicated for India, it is imperative to strengthen the public health infrastructure, invest in robust health systems with adequate security measures, appropriate disaster and emergency actions, as well as for preparedness for future pandemics. Also, in terms of this decade of healthy aging, it is pivotal to narrow the gaps between policies and practices and put monitoring mechanisms in place. This is the time for India to critically evaluate the key elements of its health policy by taking into consideration geriatric healthcare, including focus on mental health needs of older people and on disability concerns. Finally, the emerging need, as I see it, is that India needs to increase the momentum in addressing the healthy aging agenda and use all opportunities to advance the directions of Madrid International Plan of Action, especially related to Priority Direction 2, which is on advancing healthcare and well-being into old age, and Priority Direction 3, which is on ensuring enabling and supportive environments, which complements the 2030 Agenda for Sustainable Development of Living, No Burn Behind, as well as of the decade of healthy aging. Thus, prioritizing needs of cross-section of older people who live in rural, urban areas and remote areas is an urgent requirement. So, as part of my concluding comments, I want to say that there is need for assessing the aging societies. What kind of policies are there? What is the available data collection mechanisms? What are the statistics telling us? What kind of indicators and monitoring frameworks exist? Are they robust? Are they useful? Can they lead us to policy development? The region needs better understanding of rural aging factors, impacts of urbanization, migration, and technological developments on healthy lives of older people. The decade of healthy aging, which is from 2020 to 2030, is an opportunity to bring together governments, civil society, various stakeholders in concerted action to improve the lives of older people. Important is to understand that health issues need to be treated, addressed, and problems overcome. Executing policies and programs in this direction is imperative. And my final point is that voices of older people become significant and must be taken into account when we talk of policies, programs, initiatives for their health needs. We cannot just give it to them. We must involve them in. And I think this is the decade of healthy aging's main agenda, to include older people from an active participatory perception and perspective. Thank you very much.
Hi. Australia's mid-century baby boom is coming of age, with leading edge of the baby boom entering their 70s. They're facing a change of life in challenging times. At 70 years of age, the decade of healthy aging has come at a perfect time for this cohort. But what will it take to enable healthy aging for this generation and for the generations to come? In this presentation, we examine the health of Australian women in their 70s in terms of their health risks, multimorbidity, and disability. We also consider their prospects for healthy aging given their current health trajectory. The data that we're going to use are from the Australian Longitudinal Study on Women's Health, which has followed the health of these women from their mid-40s to their 70s. The Australian Longitudinal Study on Women's Health is a population study covering the health and well-being of over 57,000 Australian women. The study follows women in 4 age cohorts born 1921-26, 1946-51, 1973-78, and 1989-95. Women in the first 3 cohorts were surveyed in 1996, when the oldest cohort was 70 to 75 years of age, and the next cohort were 45 to 50. That middle cohort are now aged in their 70s. The first follow-up of that cohort occurred in 1998, and they've been resurveyed every 3 years since then. The study takes a comprehensive view of all aspects of women's health throughout their lifespan. What we notice is that with each successive generation of Australian women, successive cohorts are better educated, less likely to smoke, more likely to undertake sufficient physical activity for health benefit, but they're more likely to be overweight or obese. So now we have the 1946-51 cohort, aged 70 to 75, overlapping with the ages of the 1921 cohort in 1996. Here we see that the new 70-year-olds have better self-rated health than the earlier 70-year-olds. They also had a lower prevalence of a range of symptoms from poor memory and eyesight problems to breathing difficulties. The exceptions were that the new 70-year-olds had more higher prevalence of stiffness and painful joints and a higher prevalence of leaking urine. And that's consistent with higher rates of obesity among this generation of women. In their early 70s, women in the 1946 cohort, shown here in the green bars, generally had better scores across all domains of the SF-36 health-related quality of life when compared to the older generation of women in the purple bars. This was clear for general health and vitality, but particularly so for physical functioning and role physical activity or participation in terms of physical functioning, and similarly for role emotional. So these two different generations of 70-year-olds look quite different on these measures. The more recent generation are less likely to smoke and more likely to have adequate exercise, but they have more likely to have BMI in the obese range. Few women in either cohort were risky drinkers. There's a substantial difference in obesity between the 1946-51 cohort and the 1921-26 cohorts, with the older women having much lower prevalence of obesity at the baseline survey and their prevalence of obesity declining since then. A study of the impact of weight on the older women's life expectancy from age 70 showed that compared to women in the normal BMI range, obese women had a lower total life expectancy, fewer healthy life years, and more unhealthy years. Overweight women had a slight increase in total life expectancy, but fewer healthy years. Underweight women had the shortest life expectancy, including both healthy and unhealthy years. This knowledge from the 1921-26 cohort has implications for the 1946-51 cohort as they enter their later years with higher BMI. In contrast, for the 1946 cohort, obesity increased for about the first 20 years of the study, but then plateaued and decreased. This may be due to more obese women no longer participating in the surveys, possibly due to their poorer health, or to weight loss due to decreasing muscle mass and poorer health. However, even if they lose weight as they age, these women appear to have spent more time being obese than the previous generation. This slide shows the changes in physical activity for the cohorts. Physical activity increases until declining sharply after the age of 70 in both the 1946 and 1921-26 cohorts. The early decrease in the 1946-51 cohort may signal an age or life stage opportunity to promote continued or increasing engagement in physical activity as necessary for healthy aging. This slide shows the number of morbidity or groups of conditions that the women had in both the 1946-51 cohort and the 1921-26 cohort, and the increase in the number of diseases they had over time. And you can see that those curves almost run from one cohort into the other across the lifespan. Of course, women don't just get one disease, they get many. We see the progression for the women who had conditions in 1, 2, or 3 disease groups to ages 88 to 93, when most women have at least 3 different conditions in at least 3 different disease groups. And the disease groups we were looking at are musculoskeletal conditions, mental health, mostly anxiety and depression, coronary heart disease or heart failure, respiratory disease, including asthma and COPD, cancers, and diabetes, and dementia of all types. In this slide, we show the physical activity and disability-free life expectancy for the 1921-26 cohort when those older women were in their 70s. Most of the women in this cohort did not finish high school, and mostly they were non-smokers. 1 in 5 of the women participated in at least 20 minutes of vigorous activity at least once per week. From age 70, these women had a total life expectancy of 21.4 years, living through to their 90s, with around 18.8 of those years free of disability. However, if the women did not exercise, they lost around 1 year of life on average and spent more of their remaining life with disability. Throw in smoking and obesity, and these women lost 4.3 years of total life and 4.3 years of disability-free life. The total loss of life expectancy for being less educated, smoker, obese, and no exercise is 5.3 years of life and 6.7 years of disability-free life. So overall, we have excellent quantitative data from the study to show that many women continue to age well, even with disease, but there is a wide window of opportunity to prevent the onset of disability and some key life circumstances, with health factors being powerful drivers of living long and living well. This is the disability-free life expectancy for the women who are now 70, who were born in 1946 to 51. These women were more educated on average than the earlier cohort. Most had finished high school. 2 in 5 of the women participated in at least 20 minutes of vigorous exercise at least once a week. If they were non-smokers, not obese, and exercised, we predicted that these women can be expected to live another 23.7 years from age 70 to their mid-90s, and most of these years will be free of disability. If they're sedentary, they can expect to live 1.7 years less and with a greater opportunity of their remaining life with disability. Throw in obesity and their total life expectancy drops to 14.8, with more of their remaining life with disability. If they're also less educated, their life expectancy drops further, and again, more of their remaining life is with disability. Overall, a higher proportion of women aged 70 to 75 in 1996 both needed and provided regular care compared to women aged 77 to 73 in 2019. Many women will already be at a time where they need long-term care to help with daily tasks, but also for prevention and reablement, and to help them keep doing the things they choose to do. Many more will need such care as they move through the decade. Overall, the 1946 cohort tend to have good prospects for healthy aging, except for an increase in the prevalence of obesity. Compared to the 1921-26 cohort, the 1946-51 cohort have better education, lower rates of smoking, and tend to be more physically active. This will stand the women well as they age, increasing both total life expectancy and disability-free life expectancy. However, obese women in the cohort were almost twice as likely to develop disability than those who were not obese. Even if non-smokers, women who were obese and who did not exercise lost around 3 years of total life expectancy and 3 years of disability-free life expectancy. The big question is whether Australia is ready for the large increase in older people that comes with the ageing of this baby boom. We know we have a dire shortage of aged care workers and a very big need to improve aged care. I think we also need to think about how we take advantage of the window of opportunity over the next 10 years with a chance to help women reduce risks, maintain strengths, and manage chronic conditions to prevent progression and complications, and to adapt to their changing intrinsic capacities as they age. We also need to fight ageism that threatens people's identity, autonomy, and resilience. The way forward must also consider how the different generations fit together and support each other. Just like to acknowledge the funding of the longitudinal study on women's health by the Australian government, and also the women who participate in the study. Thank you. Our fourth presenter is Ashish Goel, who will collate presentations by all previous speakers and string together their ideas and thoughts prior to us having a chance to all discuss what's been presented today. Ashish was previously a professor of medicine at the College of Medical Sciences at the University of Delhi in India. He completed his Master's in Public Health from Johns Hopkins Bloomberg School of Public Health under a Fulbright Fellowship. He's a passionate teacher, humble researcher, a conscientious doctor with an ability to create and maintain networks at a regional and an international level. His areas of interest include medical ethics, doctor-patient relationships, medical education, applications of technology in health, geriatric care and frailty. He's currently the president of the Indian Academy of Geriatrics and the vice president of the Association of Gerontology, India. Thank you, Ashish, for pulling all our thoughts together.
Hello, friends. So in this session, I'm going to talk about the state of the elderly and the life and challenges in the decade of healthy aging. Thank you for joining this session and thank you for participating. So I'm going to present the findings that we did in a kind of a review, a literature review over the last few weeks, and also our experiences over the ages in treating older persons. I will talk about the demography and the situation in India. I will talk about the changing demands of an aging population. I will talk briefly about the initiatives of the Government of India, and I will talk about the technology and its use and impact in healthcare of the older persons before concluding. So population aging is definitely the inevitable truth that we cannot escape. In India, we have as many as 138 million older persons who are currently living and alive in their aging situation. This constitutes to about 10.4% of the national population, and it's projected that by the year 2050, this percentage would have increased from 10.4 and nearly more than doubled to 22.5%. And these will be constituting a sum total of as many as 300 million people who are older than 60 years of age. The irony of demographics is that developed nations had the time to become wealthy before they grew older. However, the developing nations like India will need to become old before they get any wealth at all. This means that the impact and the aging will increase the burden of disease in these countries and will change the nature of demands on the healthcare system that will be required in the coming times. The demands of a graying population would require us to accommodate the needs of an older population as we continue to address the communicable diseases at the same time, infections, and try to focus also on maternal and child health. The increasing longevity would be associated with an accumulation of health deficits over time, and this would lead to another and even more complexity in care. The traditional geriatric giants that have been identified would be incontinence, instability, impaired intellect, and immobility. However, now we find that there are newer syndromes which are emerging, including frailty, sarcopenia, and anorexia. The care becomes more and more complex, and as we had seen in the recent pandemic over the last 2 years, that people were vulnerable. The healthcare system, the public healthcare system became vulnerable. It was inequitable and it was very fragile. People who were older and had the COVID-19 infection had a much poorer outcome than the younger ones. Social isolation, loneliness, and mental health challenges were the struggles that this group had to face, which were unique to them. The older persons had several problems in terms of technological isolation, financial security, and a limited social support network that they always have, and this resulted in poor outcomes for COVID-19. As we are all aware, the current decade between 2021 and 2030 has been adopted by the World Health Organization as the decade of healthy aging. The Indian government, in the meantime, has launched the National Program for the Healthcare of the Elderly, which is an ambitious program, which is comprehensive, dedicated, providing easily accessible care at affordable rates, which becomes universally available without compromising on the quality of care. So that is what the National Program for the Healthcare of the Elderly envisages. And the government is committed to creating new architecture in an enabling environment for the growth and care of older persons, while strengthening the healthcare delivery for older persons with both rural and urban components in the program. Under the National Health Policy announced in 2017 was the Ayushman Bharat program, which is one of the most ambitious programs which has been launched in the entire world for healthcare facilities. This provides health and wellness centers across the country, which provide comprehensive care, including geriatric and palliative services, and also allow health promotion while preserving the autonomy and dignity of the older persons. Over the ages, it has been seen that the research on older persons is kind of a research of exclusion. Most of medical research excludes older persons from research studies owing to concepts of ageism or comorbidity profile, labeling them too sick or too unstable for participating in the research. There is a lack of insurance, there is physical immobility, there may be communication issues, there may be technological illiteracy or financial insecurity, which prevent the participation of older persons. We need a stronger evidence base in the coming decade to be able to handle the healthcare needs of the older persons. And we need age-friendly environments so that people can people can lead independent lives. So the digital technology divide has been great in the older persons in the healthcare of the elderly. And we are looking at different mobile health programs, and we need to apply lifelong learning principles which enable older persons to do what they value most while retaining autonomy in their decision making and to preserve their purpose and identity in life. So in conclusion, for the session and for this symposium, I would say that a population which is actively aging and is aging independently in health and freedom from disease increases the satisfaction of older persons while reducing their burden of disease, reducing their cost of aging, and improving their disease-adjusted life years or disability-adjusted life years, and result in a more effective and efficient nation. Thank you so much for your patient attention.
Thank you, Ashish, for bringing that all together for us. And now I'd like to open up to the floor so that you can ask all of your questions and we can just discuss together the state of older persons in the decade of healthy aging. Well, thank you, everyone. That concludes our symposium. It's been a really great discussion, and it's been wonderful to be with you here at this wonderful global Congress on Aging. I hope to see you all again soon.
Thank you. Hello, Marla. How are you?
Good.
So welcome. Thank you. Thank you for your presentation, Marla, and welcome to this discussion session. If people are listening and if you wish to put some questions in the chat, Marla and I will be very happy to answer them. But meanwhile, Marla, I was just thinking this is a good time to us to reflect from our different scenarios about the decade of healthy aging, about the state of older people, and not just the people who are older now, but the people who are getting older. So, although, you know, we're all getting older, we're all older and getting older, but if you know what I mean. So, you know, if we think of where people are at the moment, and where we think people might be at in 10 years' time. And that's very relevant, isn't it? Because we've got those baby booms in our population. So not only is it the aging of individuals, but it's the aging of the population as well, where the issues affecting older people will be multiplied. And so our need is not only on the grounds of being good humans, but I think there's an imperative in terms of sustainability as well to make sure older people have the best possible circumstances and support.
Yeah.
So where do you think we're at, Marla? Do you think we're in the race, running behind, or have a chance of winning?
No, we definitely have a chance of winning, because I think the government of my country, and I find in many of the South Asian countries too, are becoming very conscious of the fact that they need healthier lives. They need to control non-communicable diseases, all kinds of chronic problems. And there are many things which are affecting the Asian population in terms of cardiovascular problems, the diabetes, and other ortho problems. So the emphasis is coming on active aging policies. Emphasis is coming on bringing in how to age well from a life course perspective. And I think these are very good developments, which would encourage people from younger age to become conscious of the impact which their wrong or faulty lifestyles can have. And also, I think what people are realizing is that while life expectancies are increasing all around them, they find in their families, earlier generation passed away at a certain age, but the next generation is at least by 2-3 years moving up. So, so they are becoming more conscious of living well.
Yes.
And besides that, I think what is happening in many of our countries, there is a lot of emphasis being laid on literacy. There's emphasis being laid on certain lifestyle directions, certain emphasis on providing financial security and things which ultimately impact on the health. And more than that, what I see more positively is, especially with COVID, more so, a lot of emphasis has come on mental health issues, on the happiness component. And all this, in nutshell, contributes to healthier lives. I'll stop here and maybe...
Yes, I like what you said about living well, because we keep talking about aging well. And of course, given our ageist stereotypes that permeate everything, you sort of think about that's avoiding a negative, but living well is all about a positive. And of course, aging is just the accumulation of living. Older people are just people who've done more living. So that's really nice. And we have got a couple of chats and comments. So one is about physical activity and obesity, which I think fits in with what you're saying about healthier lifestyles. And the other is about positive aspects of aging. So one of the things, and Marla, you said that it's about governments, and it is very much about governments. You said it's about taking a life course approach. So I think this is really important. You can't just get to whatever you're going to call old age, 60s, 50, 60, 70, and say, oh, gee, now I want to be healthy. You actually need to be planning for that before you're even born, if you can do that. But of course, it's across our entire lives. And so as we when we're looking after our children, we're building the blocks for healthy aging for them, and then throughout our lives. But it's interesting that, so I was going to ask you a question, and perhaps the audience as well, because I know that there's people out there that are engaging with us through the chat about, is it just government saying, oh gosh, we need our population to be healthier so we don't have the burden of disease and care? Or do you think that the people themselves are starting to own the ambition and the action for healthy aging?
Yes, I think there is much more consciousness among people. If you really look all around, there is more emphasis on physical activity, there is more emphasis on nutrition, there is more emphasis on financially securing themselves. So, all these are combinations which provide support to healthy living. And when I say healthy living, I'm using a very broad context of not just in terms of a medical problem or a medical condition or a status, but providing a more social status, which includes many lifestyle patterns. And I think there is a lot of emphasis on all these things which impact. What is more important is also, I think people are demanding from their governments that certain things be put in place. They are becoming more vocal, they are becoming more participatory in things which affect them. And these, I think, are healthier signs which provide for healthy living.
Yep. So the time is right, both in terms of our government and our peoples for healthy aging, which is great. I'm just looking at the chats here, and there's a couple of things in here again to respond to. Yes, Suresh, I'm very proud of being old. I turned 60 last year, and it was my greatest birthday ever. I played the guitar, I ate food and drank wine and was with my friends from 2 o'clock in the afternoon until midnight. And it was the most fabulous day of my life, almost. There are better ones, like when I had my daughter. But I'm very proud to be getting older. I'm not going to elect for the other option. So I'm very glad to be old and very glad to be getting older and moving into the period of my life where I'm a bit of a grand dame. So thanks, Suresh, for that. And then the other question is about resilience. And I think that's a really interesting question, because we talk about people being resilient, and then we talk about older people being vulnerable. And I think the bit about being vulnerable is a whole lot of bunkum. Oh, sorry, that means rubbish. because older people are tremendously resilient. My goodness, they've lived through lots and lots of ups and downs and challenges. And we noticed this through COVID, that the older people, it was the younger people that were very disrupted and quite stressed and distressed about what was going on. But the older people took it in their stride. But the problem I saw was they took it too much in their stride, and they became a bit, well, in often cases, neglected by overall policy because it was focused on lockdown and protections. They were neglected by healthcare that said you can't get healthcare because of COVID, so it all has to be done over the telephone. They were neglected by aged care because of staff limitations and other limitations about them coming into their homes. And so I'm sure we've heard a lot about this across this conference, where people deconditioned during COVID. So they were resilient in themselves, but they deconditioned because they weren't getting their activities, physical activities or social activities or healthcare activities. And so, they were being resilient, but we weren't being resilient and responsive in how we might care for them. And we were being too single-minded and blinkered about stopping people getting infection. So I think the comment there from Mohammed Ramli that do we prepare the aging population to become more resilient? I think they're resilient. I think what we don't do is create circumstances where they can use their resilience, because they have it. We're in the way. What do people think about that?
True.
Yes.
I think what is also happening, and adding on to a kind of positive approach, is that images of age are changing. Age is no longer being looked at something to be ashamed of, something to be hidden, something to not talk about. So I think that the fact of growing up, be at whatever age it is a very positive sign of looking at life in the right spirit.
That's true.
And all this also builds up the strength of personalities. You know, it sort of adds on to coping well, to be facing things, taking challenges, and that is important.
Yes, and I think this is why I don't like phrases like 70 is the new 50, because 70 is the old 70. It's just that we never understood how good 70 could be when we were 30 and looking at 70 and going, oh my goodness, I don't want to go there. So you know, 70 is 70, and it's as good as it is for you. It's as good as you can make it, and as good as the environment around you can support it. And just taking that conversation a little bit into, you know, I worry when we say, oh, it's all about eating well, exercising, keeping your brain healthy, all of that. Certainly it is. There's a lot about doing everything we can to maintain our well-being and everything we can do to protect ourselves against disease and disability and frailty and loneliness and isolation and all of those sorts of things. But even if we're the goodest, bestest people that we can be in terms of our lifestyles and the actions we take, there will come a point where we're all going to need some support of some sort. So I think you have to have that other side of things. You have to have that thing that says aging happens, and when aging happens, there are things that happen to us by virtue of our physiology, and sometimes by virtue of pathology, because we can't all avoid that. And what can we do for ourselves and as our society to support those people? And I think that being able to look forward and say, what is my old age going to be like? What can I do to increase my intrinsic capacity as much as possible? But also, what am I going to need to set in place now in the future to provide my support?
Yeah, quite rightly said. And I think it is very important for us to build up our coping mechanisms. I mean, my point is that it should be taken in our own hands. We should not wait that government will give us, families will give us, relationships will give us. We need to build our own strength to face it. And once that kind of resilience comes into us, that kind of understanding comes in us what life means, I think it becomes easier to move on and to take every phase of life as an outcome of things we have put in, and sort of respond to it to the best of our abilities. But I also want to say here that I think we should not lay too much emphasis on the fact that everything has to be goody-goody. There could be things where certain challenge, but that's part of it. Just take it as that and not be depressed about it. And get going from it. If things are not working your way, fine. I mean, that was not it to be.
Be kind to yourself. Be kind. Yeah.
Carry on with the other things which can be better.
So we've got about 3 minutes left in this chat, which I'm enjoying. And there's a comment here about the business about that I mentioned about the women in their 70s being more physically active, but still getting heavier in terms of their weight. And I think that is a really interesting thing. And we don't know how that will play out really in terms of their life expectancy. We know that the obesity, it's not so much the total life expectancy, but it does reduce the healthy or the disability-free life expectancy. So that's going to be an issue. but the physical activity may mediate that to some extent. So certainly even if you're overweight, being physically active is one of the best things you can do. And so I think that's a bit of a saving grace for that generation, that even though they're a bit heavier, and there are some advantages to being heavier, especially for women in terms of estrogen and bone protection and that sort of thing. So I'm definitely not advising people be skinny when they're older, because then we have the problems of sarcopenia and frailty. So heavier, musclier, more physically active. So being a bit heavier may not be as big a problem as we necessarily think, but it may play out in longevity, but some disability. Yes, more disability.
True.
Yeah. Now we've got 2 minutes left. Marla, is there anything else that you would like to say, or any other questions that the crowd have?
Are there any questions?
Well, I've been reading the chats and checking the questions. So yes, I hope I didn't.
I think one of the outcomes we can think of all these emphasis on healthy aging is that we need to also have more of comparative analysis and sort of, identify what makes certain kind of populations do better than others. What are the factors which contribute in terms of conducive factors?
Yes, but in doing so, we have. Yes, in doing so, we have to be careful not just to compare country to country, because within countries there are subpopulations. You might go down the railway line, and these ones are doing really well, and these ones aren't.
So
I think we've got a lot of those answers already, though, don't we? Too, because we know a lot of it's socioeconomic. Yes, yes, and education and financial literacy.
Critical evaluations are important.
Yeah. Yes. Well, Marla, that's good, because you and I are working together quite a bit, and we really look forward to working together more, and also with many other people around the world. So we are constantly doing those comparisons and constantly sharing and advocating and acting. So let's keep doing that. We've got the decade. We can put in some good oomph and effort, and let's see where we end up. And I hope when I'm 70, the world's looking better for older people, and I've got good prospects for healthy aging. And you too, Marla.
Yes, thank you so much.
And you too, everybody out there. It's been a delight.
Bye-bye.
Thank you.
Bye, everybody.
Bye.